Hello, I'm Charles Blair. I want to give you a couple of tips on the new patient exam. There are basically three new patient exams. Code 0145 is for the child less than 3 years of age. It does include counseling for the parent. So we would use, for that younger kid, less than 3 years of age, we'd use D0145. Now, once we have a child 3 years and up, we actually have two codes for the other two codes. Code 0150 is the comprehensive oral exam, and that would be used for all patients above 3 years and up. This would be a comprehensive exam. We also have code 0180. Code 0180 is the comprehensive periodontal evaluation. Now, in order to use code 180, we have two criteria. First, the patient has to be a perio-type patient. They would have signs and symptoms of perio or risk factors such as diabetes. The code 180 can pay a higher fee, and generally code 180 is available at the higher fee for the initial exam. So what I recommend is going in the computer and setting up a code 0145, code 0150, and code 0180. Again, for 180 we have the requirement that they are a perio patient, plus we must do full mouth probing and charting. One other change that we've had in exams is that the oral cancer exam is now a part of code 120, code 150, code 180. And so that would be the visual exam, what we've learned in dental school: pull out the tongue, do the head and neck exam. And so those are the three exams. So the takeaway here is that code 180 can have a higher UCR. It generally is paid at the front end, up front, with a little higher fee. Remember, though, that is a more in-depth exam. That is a perio patient. Now, concerning checkups, we have two choices of checkup exams. Code 120, and that's the normal recall exam. That does include the oral cancer visual exam. And then we can use code 180 at checkups. Again, the criteria: it must be a perio patient, and we must do full mouth probing and charting. However, at the checkups, many of the insurance plans will downcode code 180 back down to code 120. That doesn't occur at the initial exam, generally speaking, but it can occur at the checkup. So you have two choices at the checkup: code 120 and code 180.